Hello. Hello, everyone. My name is Nehal Desai. Um, so I'm just going to briefly talk about this virus, respiratory syncytial virus, and how it actually is infecting in the body system, and also how to prevent such future infections and what it is. So we're going to talk about a couple of things here. Um, The first thing is actually what it does, what happens when someone has an RSV. Well, it's mainly going to infect the lower respiratory uh, part of the system, and patients who get it are it's going to infect the nose, the throat, the lungs. Um, it can spread through coughing, sneezing, um, and it can be very um, severe eventually. So, who is affected? Usually, the infants and young children, older adults over 65 years of age, immunocompromised patients who have really compromised immune system. They would likely get any kind of viral infection, anyways, or like bacterial infection. Um, Patients who have heart and lung disease could also be susceptible to getting this kind of infection. Usually, when it comes to uh, this type of infectious disease, some of mild symptoms the patients may receive are things like runny nose, coughing, sneezing, fever, appetite would be decreased. Severe ones, wheezing, difficulty breathing, cyanosis, which is like blue lips, um, may be noticed when um, getting this kind of infection. But how does it actually happen? So, first, there's a RSV particle. It has different parts to it. As a glycoprotein, kind of like any kind of viral uh, particle you might see as um, having a lipid bilayer, phosphoprotein, different types of protein, nuclear protein. And as you may have seen in the previous lecture, like HIV virus, this can also become more like retroviral, it's kind of like infecting the uh, viral portion of the normal cell through the genetic programming. So um, you can see here, the main one that you want to we focus on here is the fusion protein, which is F. So um, why do we say that? Because the fusion protein F is the one that will attach to the epithelial cells of the lower respiratory tract. Um, in this case, as you can see the drawing on the right, I kind of wanted to make the illustration a little bit better. But essentially, the particle will go through like the nose, and it will eventually reach down to the liver part, going to the small bronchioles and all that part, and then the epithelial cells that line there, and globular cells. And what happens is this viral particle, the RSV particle, is going to attach itself to the epithelial cell membrane, and then it's going to infect that normal cell. And What it's going to do is it's going to signal the immune cells, like the T cells, the B cells, and release the cytokines in the process. And then eventually, um, you'll see some formation of mucus, which is going to impact the bronchial tissue, and um, close up that airway flow. And so what happens here is that the because of this immune cells getting involved now, it's going to lead to more swelling inside the um, uh, airway area, or those cells or the tissues that line up through that, I like to see them as like tubes, and kind of like clog that tube. So the patient will have a hard time breathing, and it's going to become very, it's going to close the gap, so there will be less air. So what we could do in the process of prevention here is usually, getting an RSV vaccine is going to be very useful, because what it's going to do is it's going to release an antigen. Once the patient gets a vaccine in the intramuscular area, the antigen is going to be recognized by dendritic cells, or things, and then engulf it and present it to these molecules known as MHC molecules. And then the MHC molecules are going to be detected by the T cells and B cells and get activated, so that they are prepared to fight against the RSV infection. And they will fuse to the F protein, neutralize that F protein of the RSV that is used for that infection. So that's pretty much it. Does anyone have any questions? And so that's pretty much it. And if you have any other questions, please feel free to let me know. I hope you enjoyed this video, and thank you for watching. Hope you all have a good day. Thanks.